Okay, do any of the other doctors have any questions, concerns? Yes.
I'm just wondering about what kind of follow-up program you might have been planning. After the 30-day period, have you thought about bringing successful patients back for follow-ups and seeing?
We do follow-ups. We have a very specific follow-up program that we create for each individual patient who leaves. Some need more than others. We always do at least 30 days. We're always in contact with family members. They really don't leave. Some of them ended up working here at the treatment center who really didn't have any other family to go to but had a strong need to get clean. But absolutely, that's part of the whole plan.
Do you think after you complete your book that maybe you'll want to go on tour or move on to a different position?
I'm really comfortable here at this center and in this area. I do travel quite a bit and give the presentations and the publications that I've been working on have become a big hit. So they're doing some videos. It's just primarily used to train around the country. I think that this moderation thing is coming back. It's making it come back. Kind of tweaking it.
May I? Yeah.
Please.
So first I just want to start off by saying how lucky I feel that we are to have a doctor of your qualifications and also who has gone through these experiences so that they can help relate with our patients. I was wondering if your choice of using this moderation management is colored by your experiences with the 12-step programs when you were going through the program.
Absolutely.
Earlier.
Absolutely, and I think that's why it's most effective. I don't share that with the patients because it changes the dynamic of my position. But I have no question that that's the success, and I have no regrets because it's put me where I am.
So, but you said you were addicted to cocaine, was it?
Yes.
In the 80s?
That was my particular drug of choice at the time.
Right. But since that's an illegal substance, do you still go with a moderation plan with that, or is it a?
Of course not. That'd be unethical.
Okay. That's what I figured. I just want to make sure.
Do you drink?
Myself?
Mm-hmm.
No.
So, what was it about the 12-step program that you rejected? Or that you reject as a doctor?
Well, it just doesn't always work for everyone. I think it's, and it's proven it doesn't work. I mean, people in and out of 12-step programs for years, and they've just not succeeded in any kind of real recovery or long-term abstinence. And so, and there's narcotics, there's sex addiction. Some people are addicted to washing their hands or compulsive behavior, and there's so much more to it. It really isn't about alcohol or the narcotic. It's deep-rooted problems that you have to face and get to the bottom of. And most especially, as I mentioned, I think it all boils down to meeting your own needs. And so, affirmations, we practice, I'm always pushing affirmations and ways to build your self-esteem.
How do you feel about the family clinic policy of allowing people in that do have addictions to, for example, cutting or washing their hands or sex or not only drugs and alcohol? Do you believe that these addictions are interchangeable and that we're doing the right thing on that?
It's all the same. I think it's all the same.
Anyone else?
Because it really isn't about the drug, as I say, which is why there's people who get addicted to opiates because they're in pain. The doctor prescribes them, and they get to where they can't even get out of bed or function unless they have them. Well, it's not really hurting anyone. As long as they aren't driving or doing, if that's the only way they can care for their children, get up and function. I think in moderation, we can learn it. So I don't think it's about the drug. I'm trying to teach these patients how to take care of themselves as much as they can through their lifetime.
And so what do you do for fun?
Well, I enjoy dining and theater and enjoy movies and reading. And I try to take my own self out on a date once in a while, whether it be for sushi or a good book. I really treat myself at least once a week on a date.
Oh, you're so healthy.
Spend time with my daughter.
Do you, and how is your daughter doing?
She's 14. She's kind of a little bit of a loner. She's taken up photography.
What's your name?
Lisa. Struggles with her weight, but it's kind of hard as a mother to play therapist, doctor, so it doesn't work as well at home.
Sure. And how's her relationship with her father?
Good. It's good. Like I say, we worked it out. It's really, I asked her one time if she ever wished we'd get back together, and she's made peace with it, which is great.
And do you have a partner or boyfriend?
No, not at this time.
And have you,
my freedom.
you enjoying your freedom? Okay. And have you ever had a situation where you felt drawn to one of your patients?
I think over the years that naturally has happened on a couple occasions, but I know my boundaries, and yeah.
You realize that we just had to let that doctor go because she had an affair, and
Sure.
that was terrible.
Yeah, and it can happen. I mean, you're getting into deep personal things, and it's human nature. I've seen hundreds and hundreds of patients, and when you're on that level, working with them, it realistically can happen. So you have to just set your boundaries.
Right. Okay. Any further questions? All right. Well, Dr. Leonard, it was just a pleasure to meet you, and we will be working together closely. So I look forward to that. Any questions or concerns about any of the patients we just let in? Or
Well, the ones that we, talked to this afternoon, as I said, I think Sheila's going to be quite of a challenge. We'll worry about who we're paired up with, but we are understaffed. We're completely at capacity, so we're going to make it do. I think that they have a common need, and that is to get to the bottom of what their true deep problems are. And we're going to work on that.
I know what I want to ask you. What is your greatest success story that you feel, and your greatest failure that you felt here in terms of your patient care? Like a specific case by case.
I released someone too soon, and he was in his 40s, so I thought he had it, and he took his life 2 days later.
I'm so sorry.
Within the note, I was mentioned several times. So the family still, holds that. It's very hard. It's the hardest thing we do. And success rates, though, they're there. It's what I strive for. It's what my passion. I mean, I've had families just send me gifts thanking me for changing, their child's life, and watching them thrive and seeing the color come back in their face and their cheeks be full again. And it's very rewarding. And it's happened multiple times. And so I don't know if I could pick one most successful. I think a girl who's able to find her true self, it reminded me of me, kind of mirrored my youth and struggling with cocaine, and then seeing her discover that it was her own needs she really needed to meet, and her getting that. And years later, her still thriving and has a family, and it's a very rewarding job. So I love it.
Wonderful. Yeah. I just wanted to mention, you're so attractive. You're